why can't I thumb pull my way out of a recessed maxilla? Once again, going back to the protraction, thumb pulling, protraction, I mean, it could work. It's going to take a long time. What vectors are you putting on the maxilla? How old do you have to be? You definitely have to be on the younger side to get meaningful benefit. It's going to take forever. Do I think that can work? Absolutely. But are you going to flare your teeth out and you're putting just your hands in your mouth? I mean, it's got to be pretty frustrating doing that for a long enough periods of time to get benefit. And you have to be young. Like, that's the bottom line. It's not as effective on adults. So you have to have known about it when you're in your early pre-teens or teens, and what type of impact are you going to have on your maxilla, on your teeth, the flaring, your thumbs, etc. Yes, keeping your wisdom teeth. It's mostly an American thing that we take out wisdom teeth on teenagers, and the reason why a lot of dentists, orthodontists, oral surgeons prefer having the wisdom teeth taken out on younger adults, because the bone is softer, the teeth aren't fully formed, and they say, you know what, let's deal with it right now before the person becomes an adult, because it is significantly harder with more post-operative complications as the patient ages. So why do we, in our practice, want to keep wisdom teeth? One, it maintains bone. Number two, there are some studies, and we've talked about this before, that does maintain possibly the airway and the musculature in the back. And also, we think that over the course of 30, 40, 50 years, that being there versus not, it could also impact the way the tongue sits. And so we prefer to keep them if we can. There are exceptions, obviously, if there's significant decay, abscesses, or impactions that may cause harm to the adjacent teeth. And so then we will recommend extractions. So there are more reasons to keep them than not, than what would be suggested in the United States. So retractive elastics, we don't prefer to do anything retractive unless there's a true reason for that. Sometimes we'll use retraction in orthognathic surgery preparation. And sometimes we will use retraction to get the teeth aligned slightly for cosmetics, but there are reasons for retractive elastics, but generally we prefer not to use that because we don't want to shrink the airway. We don't want to shrink or push back the mandible or the maxilla. Well, once again, there are time and places for class 3 elastics. There's a fine line between over retraction and just enough retraction. Sometimes even with expansion patients, we'll use that have a class 3. Even with expansion, we'll use class 3 elastics sometimes to reposition the jaw and bring the maxilla a little more forward with class 3 elastics and correcting the overbite and overjet. MSE is maxillary skeletal expansion. It's been around for a while now. It was pioneered by some of the doctors in Korea, and it's been around the world. It's still being used. We still use it on some of our teenage patients that don't necessarily need a custom MARPE, or maybe they can get away with a 2 or 4 screw MARPE or MSE. So we still use some of the medical Korea MSE 2s, but that's usually on younger patients. Custom MARPEs, they're definitely used around the world as well. We've been using custom MARPE for probably about 5 or 6 years now. We've had amazing results. Up until FME, that was all we did. Now we have also the FME appliance that can utilize that's 100% bone anchored. Yeah, I mean, expansion, airway orthodontics can save your life. Now, what does that mean? That means that as time goes on, the cumulative effects of lack of oxygen, the cumulative effects of mouth breathing, the cumulative effects of not sleeping well is taking a toll on your life expectancy, the quality of your life, the happiness and things that you can have from a better breathing and sleeping. So yeah, you can chew better, you can sleep better. It helps with some of our patients with anxiety, depression. Some of our patients get migraine relief. Some of our patients get TMJ relief. So expansion and airway orthodontics helps out so many people, and that's our mission over here, is to bring this to the masses and to have more awareness about airway health. Does MSE work after 18 years old? So we currently use the custom MARPE or the Phasegenics mid-face expander. And yes, we can create expansion after 18. The difference between a child expander and adult expander is we place mini implants into the palate that allows for anchorage, and that with stability allows for the mid-palatal suture to split and expand. So to recap, MSE, custom MARPE, FME is what we use on adults. and late teenagers. What happens to the mandible after expansion and protraction of the maxilla? That's a great question. As you can see from Dr. Newazz's GIFs, the maxilla has expanded about 9-ish millimeters, resulting in 3 to 4 millimeters of anterior movement of the maxilla. So how does the bite and the mandible accommodate? The mandible has some positioning ability. So usually we say even 3 to 4-ish millimeters of anterior repositioning. But if it were to be more than that, then you would need mandibular jaw surgery, BSSO, that type of stuff. There's other ways to do it with mandibular distraction, but generally speaking, you have a little bit of play, 3 to 4 or 5 maybe millimeters of anterior positioning that can happen with the jaw. If you look at Dr. Newazz's GIF, you can see that his jaw actually does reposition forward. And in MRIs that he's taken, you can see the remodeling of his jaw joint as well. So now the advantage of expansion, you get the better nasal breathing, better ability to reposture your tongue in a more anterior forward position with the widened maxilla. Then you also get the ability for the jaw joint to come forward, release some of the tension on the TJ, reposition. It also opens up your airway slightly too. Sutures that are being cut for expansion, generally in our office, we do the mid-palatal suture from the mouth side. There are other sutures that can be cut, but the one that we do locally in the office is the mid-palatal suture. I like the gap, so can I keep the gap between my 2 front teeth? Yes, you can. With any expansion, custom RP, MSE, FME, our patients do get gaps because we're actually expanding the palate. Some patients do want to keep the gap. It looks kind of who they are. And so we don't necessarily need to get rid of the gap. The only thing is we'd have to plan to keep the gap and also maintain the aesthetics of the gap. A lot of times with expansion, the teeth kind of drift together. So they look a little bit diagonally positioned. So with the Invisalign or the braces, we could upright that and manicure that gap to make it look nice and aesthetic for you. Protraction in adults. So protraction in general, as of right now, it's something that requires a lot of homework. You need to, this applies to adults and children, you need to actually wear the protraction device. So the more you wear it, the better results you get. The younger you are, the better results you get. We have done protraction on adults. Adults should wear it at least to get good results 12 plus hours a day, which is a lot if you think about it. It means that if you were to come home after work or after school, you're wearing that from maybe 6 p.m. to 7 a.m. or 8 a.m. the next morning. That's a lot. Now, the longer duration you wear it in terms of hours per day and then also months/years, the better protraction you get for the maxilla. Protraction versus double jaw surgery. There is a limit and practicality to how much protraction can bring the maxilla forward. And there is also a limit to how much the mandible can be repositioned forward. So I would not say that protraction in patients that need double jaw surgery should be the solution. I think that, for double jaw surgery, it's definitive. It's you can calculate and plan out exactly how much forward advancement that you want. Versus with protraction, you're almost seeing what results after a very long period of time. So if you want results that are almost guaranteed, quick and definitive, then double jaw surgery is your solution. If you're trying to avoid double jaw surgery and you need maybe a little bit of protraction, then headgear or protraction can help with that. Is there a time where we wouldn't recommend jaw expansion or surgery? Yeah, some people don't need it. Some people that have good nasal breathing, that have good skeletal architecture, don't need it. Some people that have other medications that they're taking don't qualify for it. So expansion isn't for everybody, isn't necessary for everybody. But the way that our jaws are trending, as written by Dr. Sandra Khan, is that our jaws are shrinking with time epigenetically. And so as time goes on, we're going to be seeing, impacts of the jaw shrinking, including impact of wisdom teeth, including mouth breathing, including restricted nasal breathing. So we're starting to see that it's more prevalent to do expansion with time. expansion maybe 200 years ago may not have been necessary like it is now. So does everybody need it? No, not everybody needs it. But do a lot of people can benefit from it? Absolutely. Yes, we done an FME on a patient with anterior open bite? Yes, we expand the maxilla, and then we, kind of like what I was saying before, we reposition the jaw a little more forward. And if we need to do some orthodontics or get that patient ready for jaw surgery, we can. When we'll be traveling to Europe? Well, as of right now, the only people that have plans to go to Europe is Mr. Mall over here. But other than that, Dr. Newaz and I don't have a license in Europe, and we don't currently install our expanders there. If coming to America is a challenge, then we can see in Malaysia at a clinic that we work at with an oral surgeon, and so we treat some of our patients from the Southeast Asia continent or Asia in Malaysia and Kuala Lumpur. So that's convenient for a lot of our patients that can't come to America.